Coming up next on Arizona Horizon, mental illness and its connection to violence. What are the warning signs and what can be done? Good evening and welcome to Arizona Horizon. I'm Ted Simons. The tragedy in Newtown, Connecticut is raising the debate over a variety of issues, including gun control and school safety. It's also increased awareness of mental illness and its association with violent incidents. Here to tell us what is known and what we should know about mental illness and violence is Scottsdale psychiatrist Dr. Michael Yasinski. Good to have you here. Thanks for joining us.
Yeah, no problem. Nice to be here.
Define, if you could for us, dangerously mentally ill.
Yeah, so state to state varies a little bit, but I'll stick to kind of the Arizona statute here. And really it comes down to about three things. It means you're imminently at risk to kill yourself, imminently at risk to kill somebody else, or if you're taking such poor care of yourself that you can't meet your basic needs like shelter, eating, those three things kind of fall into the severe mentally ill that you could be against your will given some type of medical treatment.
How does that delineate between what you're talking about and then the dangerously mentally ill who may very well be able to take care of themselves and may be able to function in a variety of other ways, but who have this other thing going on?
Right, so part of the problem, and I see this all the time with my patients, is I see people not doing well at all. A lot of people have something called psychoses, which is simply being out of touch with reality in diseases like schizophrenia or bipolar. They lose their insight, they lose the ability to think rationally, but yet they're not necessarily violent at the moment, but you know, you let them go live in their house, they're not able to be forced into any kind of treatment, and you know, as the days go on, that process gets worse and they become very violent sometimes, and by then it's too late to act.
Well, what are some of the warning signs then where you could maybe see someone who is unfortunately progressing from that A to that B?
Mm-hmm. So I think if you can, especially family and friends, if they can keep an eye on the person, that's always a difficult thing, because one of the big things is these people start to isolate. And when you're isolating, it's very hard for family and friends to even see what's going on. So I always say if you notice anybody, especially with an underlying mental illness, that they're isolating, I think you need to have, whether it's your friends, check them out, or I actually encourage people to call the police. They will go do a well check at their home and knock on their door, and you can't get in any trouble for doing that. The police will show up, they don't mind, and at the very least they can put their eyes in the place and make sure nothing too crazy is going on in there.
Has the definition of a dangerously mentally ill person, has that definition changed over the years?
I think it's subtly different from state to state, but in general it's pretty much the same criteria of the harm to self, harm to others is really the main two components of that. And
if someone vocalizes, maybe writes this down, their intent to do these sorts of, is that dangerous enough to have some sort of interaction occur?
Yeah, it has to be specific, almost to the point where someone's writing a plan down to hurt you, for example. Just writing down things like "I like to hurt people" often aren't enough, especially in Arizona where we have pretty strong rights for the people. If it's too generic, that's often not enough. If it's simply talking about how I want to die, but I don't have any specific suicide plan, that's often not enough. So as a psychiatrist, I end up trying to take these people in to get hospitalized. The center says, no, there's not enough evidence, so they go back on the streets, and there's nothing left to do for them until they get worse and then finally meet the criteria that they need to get worse, but by then it's too late.
And when they get back on the streets, and you mentioned the rights of the mentally ill, you're talking full rights here. You're talking Second Amendment rights, are you not?
Right. No, they have full rights, and even more rights in terms of, you know, we're the ones that have to prove beyond a reasonable doubt almost just to show there's some risk of these people doing something. I mean, we just have to present so much evidence, and they just have to present basically the fact they're just living at home doing fine, not doing any of this, and that's enough to let them go.
Is there, do you sense or see a push to change this, especially in light of recent incidents?
I know in Arizona we have some attorneys working very hard. I know Chick Arnold's an attorney here in town working very hard on these kind of things, and in my view, from a practicing psychiatrist, I think there has to be more lenience on who can we get into involuntary treatment when, like a professional opinion like myself, we can see that just because there's not X, Y, and Z there's other symptoms that are just as concerning that maybe don't meet the criteria, but concerning enough that I think they have to be evaluated in a hospital. So a little less stringent and rigid needs to happen, in my view.
And once they are evaluated, once they are available for treatment, if you will, how do you treat those, again, not just mentally ill, but dangerously mentally ill?
Yeah, so it's the same, you know, it's even hard once they're in treatment to keep them there, because if they stop saying that they're violent or they stop saying that they want to kill themselves 2 days into the hospital stay, then that's already a path to get out of that hospital stay very quickly. So it almost has to be like they're consistently saying those things to get any kind of forcible treatment. So the hope is that they're recognizing some danger and you're able to medicate them, and that medication gets them better enough to the point where some of their underlying mental illness starts to ease away, and they come back to reality and they start thinking more rationally, and they're on their way to getting better.
When you hear about these incidents in Tucson, in Newtown, Connecticut, in Colorado, the many incidents it seems like in Colorado, when you hear about these people and their lives leading up to these incidents, any surprises there at all?
I think a lot of these people have the same background stories. In terms of typical kid in school, typical kid tends to isolate, typical kid, you know, maybe involved in computer games in the beginning. I mean, they kind of have that same few features, and you know, it ends up being pretty consistent across the whole board if you look at that type of person doing these kind of things. Because even though mental health patients don't have a hugely higher risk of violence, it still is there. It's still 2 to 3 times more violent than the regular population when you're looking at schizophrenia, bipolar, major depression, alcoholism. So it's a significant amount. Even though most aren't violent, you know, it is a significant percentage compared to the rest of the population.
Indeed, and most kids who are isolated and playing video games don't wind up doing these sorts of things. So it really is, the balance there is very difficult to find.
Right, no, exactly. The other thing is you have to be careful about part of the labeling, or part of this kind of talk of how can we label people violent and how do we get them treatment, and let's even force them into treatment a little bit easier. All of that works for kind of the current system of safety, but then you look back and think, well, what is the underlying problem that needs to be fixed in mental health? And it really is stigma, right? So the stigma of psychiatry is what makes people not want to even get help. So if you're further stigmatizing them by saying everyone's a criminal who's a psychiatric patient, you have the people that maybe would want to get help, but now they don't want to come forward because they don't want to be viewed as a criminal. So it's a very tough slope to, I personally feel it's getting that stigma out for people to want to get help, because there's just no way to force help on, you know, we can try hammer the help forcing wise, but that's just not the right approach in my opinion.
All right, well, great insight. Good to have you here. Thanks for joining us. We
thanks.
appreciate it.
No problem.